Welcome everyone, and thank you for joining us for today's webinar. I am Audra Mitchell, General Manager of the Massey Learning Institute, and your host for today's session. We have a lot in store for you today, so before we get into our presentation, just a few housekeeping reminders. During the presentation, you will be invited to post your questions in the chat, and at the end of the presentation, we will have our Q&A segment. To help us with addressing as many questions as possible, if someone posts a question that is similar to what you wanted to ask, just click the thumbs up button next to that question, as this will ensure that we maximize our time today. Please note, a recording of today's session will be made available on MLI's YouTube channel, as well as via the Massey Connect app. October is Breast Cancer Awareness Month. And according to CARPHA, the Caribbean Public Health Agency, and I quote, breast cancer is the main cause of cancer deaths among Caribbean females, accounting for 14 to 30% of cancer deaths. This disease has a significant impact on women's health and is 2 times higher in the Caribbean compared to the USA. I have also read that in the USA, it is the second most common cancer among women. With statistics like that, all the more reason why it is critically important for all of us to be educated and take a proactive approach to fighting this disease. So to assist us with this, it is my pleasure to welcome back to our Webinar Wednesday platform, Dr. Asante LeBlanc, and please permit me to do a brief introduction. Dr. LeBlanc is a general practitioner and certified medical herbalist. She's a graduate of the University of Western Ontario and the Institute of Medical Sciences of Havana, where she obtained a Bachelor of Sciences degree in biology and her MD, respectively. She is also the medical director of Victoria Clinic, a multidisciplinary healthcare facility in Trinidad, and she currently serves as chairperson of the board of directors of the Trinidad and Tobago Cancer Society. Dr. LeBlanc, we welcome you and thank you for agreeing to be here with us this morning.
Morning. Thank you for having me. My pleasure. I'm back since last year, so I'm here. So without further ado, I'll start my presentation. And then you'll challenge me with new stuff this year. I wonder whose idea that was. But let's see if I'm going to deliver. Okay, so let me get going. Let's see here. Right. Okay. Right. You can see that, right? Right. So breast cancer awareness by the Trinidad and Tobago Cancer Society and myself. So I know last year we covered this, but for those of you who did not see it, or if we need a reminder, it's always good to remind yourselves of the definition. What is cancer? So cancer is a term used for diseases in which abnormal cells divide without control and are able to invade other tissues. Cancer is not just one disease, but many diseases, and there are more than 100 different types of cancer. Most cancers are named for the organ or the type of cell which they start. What does this mean? Our cells are programmed from the minute that they're formed from a pluripotent cell in our body. Our cells are programmed how to function, how to grow, and when to die. It's all done via genetic coding with our DNA code. I know with the pandemic, we're all accustomed to hearing DNA, RNA, and codes. However, if that programmed cell death does not occur, or if there's a problem in the cell as it's dividing and the ability, the machinery of our body to take that cell out and that cell continues to divide, that in essence is cancer. So while we talk about breast cancer, we're looking at the cells of the breast, which are mainly the milk ducts and the surrounding tissue around the ducts. So this is just a picture for you to see. When the pink cells at the top, those are the normal cells. We have this green cell here, which is damaged, but it's not, and so it's lost the ability to die, apoptosis, which is the natural cell suicide or cell death. and therefore it continues to divide. And as you can see below, it divides and divides and divides and becomes a tumor. But what really is cancer for us all? Cancer is a lifestyle disease. Cancer is one of the leading NCDs, or non-communicable chronic diseases, or if you're in Trinidad or in any part of the Caribbean now, it's one of the comorbid conditions associated with an increased risk of death with the COVID-19 pandemic. It's the most prevalent cancer in women in Trinidad and Tobago and the Caribbean, and it accounts for the highest percentage of death by cancer in women worldwide and in Trinidad and Tobago, right? It is in itself and in essence a pandemic. So are all tumors of the breast cancer? The answer to this is no. You can have benign lumps, and these are called mostly fibroadenomas or cysts. So we have benign and we have malignant. And this is why it's important to have your self-breast exam done, followed up by an examination with your family physician. So what are the benign tumors? Benign tumors means that they're not cancerous. Very rarely are they life-threatening. They can often be removed, and in most cases, they won't return. And they don't spread to other parts of the body, and they don't cause a generalized illness. Malignant tumors, on the other hand, are cancerous. They may be life-threatening, and I want you to get that. They may be life-threatening. Breast cancer diagnosis does not equate to a death sentence. They can invade nearby tissues and spread to other parts of the body, and when a cancer spreads from one part of the body to a distant location in the body, this is called metastasis. So what are the types of breast cancer? We have invasive and non-invasive breast cancer. Again, we have invasive ductal carcinoma, invasive lobular carcinoma, inflammatory breast disease, locally advanced breast cancer, Paget's disease of the nipple, a phyllodes tumor of the breast, and metastatic breast cancer. Those are the main types of cancer. So ductal carcinoma in situ is usually a very early stage, and it's in the duct, as it says, ductal carcinoma in situ. So it's in the duct, and it's often called non-invasive breast cancer. Invasive or infiltrating ductal carcinoma is when it starts to spread from the lining of the duct and goes into the breast tissue. Invasive infiltrating lobular carcinoma is when it's the lining of the milk glands themselves, which are called the lobules, and it spreads and infiltrates into further breast tissue. Inflammatory breast cancer is another type of invasive breast cancer, and this is where it's as the word says, inflammatory. So you feel like if there's an infection, so it can often be missed and thought to be like a mastitis, but it does have to be investigated. Yeah, so those are the types of breast cancer. So here's a nice demonstration that what is the majority, what is the highest percentage that we see, and the highest percentage, between 50 to 70% of the breast cancers are invasive ductal carcinomas, 20% are ductal carcinoma in situ, and 10% invasive lobular carcinomas. So what are risk factors for breast cancer? When we think of risk factors, we have to think of two groups of risk factors: modifiable risk factors and non-modifiable risk factors. Non-modifiable risk factors means you cannot modify this, and that includes things like your family history, so genetics. Is there a first-degree relative that had breast cancer and their first-degree relative with breast cancer? Did mommy, granny, auntie have it? Daddy's mommy, daddy's auntie, daddy's sister, did they all have breast cancer? Did they die or did they survive? Those are risk factors that you can't modify. Age. Although we can see breast cancer in younger patients, age is a factor, especially when it comes to the older that the woman is when she has her first child, the age that she started having her period, and a woman who's never had children. Those are risk factors that you may not be able to modify, especially the menstruation. And well, when you have your first child, you may not be able to modify that for many reasons, right? Also, women who go through menopause after the age of 55, and therefore they have more of a hormonal stimulation towards their tissues after 55, that's a risk factor. And that can also be due to genetics, because we often ask women, when did you start menopause? When did your mommy start menopause? Because that generally will be the trend for the woman to start menopause around that age. And the use of oral contraceptives and hormone replacement therapies. Other modifiable risk factors include your lifestyle. I told you, cancer is a lifestyle disease. And if you look at what we are preaching a lot of when it comes to NCDs, it's about lifestyle. So what is modifiable? This means we can make a change. We can be proactive about these risk factors. Number one, the diet. That's a big one. Is your diet in balance? Quality of your diet, quantity of your diet, so portion control. What are we putting into our bodies? The processed foods, the excessive alcohol, excessive red meat intake, and coupled with a poor diet, lack of physical activity leading to you becoming overweight, especially around the little waist there. Those are serious risk factors for breast cancer. Again, alcohol use, excessive alcohol use, and some viruses and bacteria, although there are not many when it comes to breast cancer, right? Sunlight. So as you know, you've heard about climate change, all the damage to the environment, therefore the ozone layer has been damaged. So the sun rays that come in are now a little different, and they actually can cause a problem with that same genetic code I told you about. If the sun rays hit our cells, they affect that genetic code, and therefore the cells stop having their correct function from sometimes, right? Was it catch-22? We're using sunblock to protect ourselves against those sun rays that can be harmful and cause cancers. But then when we use the sunblock or we don't go out in the sun, we have a vitamin D deficiency and our bones are affected. So it's a very ticklish situation and a catch-22. And ionizing radiation, if someone works in radiology and they're exposed to rays, or if you work in different industries, there are also some chemicals that are harmful, such as asbestos, formaldehyde, and other petrochemicals. Pesticides as well. You would have heard about Roundup. Yeah? What about men? Can men get breast cancer? So we have been pushing to educate men over the past 5 years, I would say, to let men realize and recognize that they too have breast tissue and they too are at risk for breast cancer. In the Caribbean, the risk for male breast cancer is low. However, in the United States, it's 1 in every 100 breast cancer patients, 1 in every 100 is a man. So men can get breast cancer. So we recommend men will not do annual screening with mammograms, but we do recommend men when they're bathing and so forth to feel their breast, palpate it, and if they feel a lump, immediately get that checked out. What do we look for? What are we looking for when we tell a woman to do self-breast examination? What do we mean? I'm not a doctor. What am I looking for? Here are some changes we look for. Lumps in the breast during your self-breast examination, or just a lump under the arm in your axillary region or your armpit. Unusual bloody or nipple discharge, or an unusual purulent discharge or a yellowish discharge, and it's unilateral from one nipple. That's a change to note. Irritation or dimpling of the breast skin where it looks like an orange. So they call it peau d'orange in French. I speak more Spanish than French, so pardon me if I mess that up. Breast or nipple pain. Inversion of the nipple, where the nipple is no longer out, it goes in. Redness or flaky skin around the nipple area or on the breast. An itchy rash around the nipple for prolonged periods of time. A big change in the size of the breast. Important to note, ladies, you know your breasts are never going to be the same size unless you pay for them. However, it's never a marked difference. And so if there's a huge difference all of a sudden from one breast to the other, it should be checked out. And again, thickening and swelling of any part of the breast is something to note and get checked out. What are the screening tests? While the gold standard screening test as of now for breast cancer is the mammogram, it's a much more integrated and holistic approach. How do we start? Monthly breast exams. Teach your girls from the minute they hit puberty and they start to have those breast buds, let them get accustomed to doing their monthly self-breast exam. 5 days after your period has stopped, you start to do your self-breast exam. You show them how to do the breast exam, which is where the breast that's being examined, they put their hand of that breast behind their head. They use the pads of 3 fingers of the opposite hand, and then they will then palpate the breast in circular motions in a clockwise or counterclockwise direction, and they go from outside the breast to inside and then squeeze the nipple and then go under the armpit, feeling for any strange lumps. This is important for you to understand what your breasts feel like, the density of your breasts, the lumpiness of your breasts, because we can have women with dense, lumpy breasts. That's done every month. I'll give you a bly. Times might be hectic every other month, but look at your family history. A clinical breast exam done by your physician. This should be done every year. Your doctor will check your breasts every year and then be able to, and you will tell your doctor, I'm not feeling this. I felt this month. It's going on. You know, this pain is here. I'm feeling this. Feel it, doc. And the doc is going to do your annual breast exam. Then, from the age of 40, in the general population, we start the mammogram. The mammogram is an X-ray picture of the tissues inside their breasts, and they often show a breast lump before it can be felt. We start at 40, but stick a pin. If you have certain family history or individual history, we may start your mammograms at 35. If we have something else that is compelling us to do the mammogram before, it will be done as we work that patient up. The other screening tests that we can use, if all 3 of those are inconclusive, include the breast ultrasound and the breast MRI. That, in a nutshell, is how we screen for breast cancer in Trinidad, in the Caribbean, and in the world. So, I was asked, are there any new screening tests? No, there are no new screening tests. Research is being done to see if there are any other ways to point out to get more sensitivity. But as of now, to this day, the best screening tests are the ones I mentioned. The MRI, a lot of people are excited and think, oh my God, MRI, that means it will show me much more. But we have a false positive rate in the MRIs of 8%. 74% of women who've had an MRI on the breast and then did a breast biopsy because there was a suspicious lesion did not have breast cancer. So it's thought best to use only in special cases after you've exhausted the ones that I mentioned before and in certain other cases. When do we screen? I've said it before, but I will say it again because I need you to all understand. When do we screen? It depends on your family history. So this is when the mammogram screening starts. But in general, we'll start at 40. But before 40, as I told you, from puberty, start your self-breast exams. I told you when, 5 days after your period is finished. If you do not have a period, so you are in menopause, you choose the same day every month to do your self-breast examinations. What are some of the falsehoods that are very common? I heard that there are new digital tests that are better than the mammogram. False, not true. The mammogram can be done without compression. Definitely false. There's no mammogram being done without compression. There is new technology, state-of-the-art technology with very little compression pain. And that is also offered at the Trinidad and Tobago Cancer Society. Another falsehood, we need to do all the tests because we saw it on the television. Because everybody believes that for some reason the Caribbean has to be backward. Don't be fooled. Not because you see it on TV in a show or anything. Trust me, the guidelines are there and we constantly try to make sure that the guidelines are not only followed, adhered to, but applicable to our population, right? The truth is this. How do we diagnose breast cancer? After you do your screening, if for any reason there's a suspicious lesion, to diagnose or to further work up, we will do a spot compression or we may go straight to a breast biopsy. The breast biopsy can be done via ultrasound guided fine needle aspiration or a true cut biopsy. That's how we would diagnose, because we take samples of the lesion that we find is suspicious and we send it off to the lab for histopathology to then look at the cells under a microscope and tell us, is this looking suspicious? Is it cancerous? And if it is, they will then proceed to do further staining to work up the type of cancer that is there. What are some of the common myths that you hear about? Mammograms cause cancer. Mammograms are not good. Digital mammograms don't use compression. And the ultrasound is just as good as the mammogram. These are myths. This is not true. Now, I know that there's a small proportion of women who are extremely flat-chested, not well endowed, and therefore they may not have enough breast tissue to go into the mammogram paddle. We do have a paddle for small breasts. However, if there really is not enough tissue, then we will do the ultrasound, right? Because there's not enough tissue to go into the mammogram. But almost all women and even men can be mammogrammed. So what's new? What's new in breast cancer? What's new in anything that we're talking about for October? Treatment for breast cancer. Tremendous steps have been made when it comes to treatment. What are our options for treatment? We have surgery, we have chemotherapy, hormonal therapy, and radiation therapy. So what is new now in treatment is that they've got new chemo drugs that may be able to hit a lot more of the very aggressive cancers, but there's nothing new, and they've also done immunotherapy for certain cancers. They really are looking at a lot of research to see how they can get to the most aggressive cancers. There's also an increase in genetic testing for certain cancers to see if we can then be more proactive and let from your ancestry let you know what you're at risk for. And then a classic example of this, as you know, would be Angelina Jolie and Patti LaBelle, who did genetic testing. All their siblings, their mother, everybody had breast cancer, did the genetic test, their genes were switched on, and therefore they were able to make a decision and say, I am going to do a prophylactic mastectomy. That means cut everything off, pay for some nice perky boobs, and you're good to go. So that is what they did. Any new treatment, as I told you, immunotherapy for breast cancer and especially metastatic breast cancer. So more and more with metastatic breast cancer, this is when breast cancer is at stage 4, but the women are persevering and are trying to survive, and therefore there's therapy that allows them to have a quality of life and live with the cancer, and therefore they're in the category of metastatic breast cancer, but they live with it, and the medication will keep it at bay basically. And they're doing a lot of research on immunotherapy for metastatic breast cancer. So where are we now when it comes to breast cancer worldwide? Because Trinidad, I'll tell you where we are, but worldwide, let's look at worldwide. The latest article from September 2021 from Research Done shows this. Lifestyle modification is key. Screening is key because this allows for increased survivorship in Black women, which means from the research done in the first world, that pertains to us because we're considered that socioeconomic class, right? Where are we now in Trinidad and Tobago? We have to constantly remind ourselves and remind our families and remind our children and ingrain it into our youths. Lifestyle modification, no smoking, no vaping, no excessive alcohol intake, eat properly, balanced diets, effective sleep, stress coping, exercise, communication. All of that is a holistic, balanced approach to the factors you can modify, the risk factors that you can modify. The Trinidad Tobago Cancer Society is forever advocating for health equity. That is a must. It's a must that every single woman across Trinidad and Tobago has access to our services, that there's no barrier to access, because with screening, and your lifestyle modification, screening will allow for early detection. And with your lifestyle modification, we will have, coupled with that, increased survivorship. We have these tools and we have to use them. There is no confirmed cure for breast cancer, but your best weapon against breast cancer is what I mentioned. Now, alarming, but also inspiring. For example, in our last year in our clinic, we saw a 66% of positive breast cancer patients in the patients we screened. Oh my God, 66% with cancer. But guess what? It's 66% of women, and most of them got detected with an early stage of breast cancer, which means the treatment regime is much, much more friendly, dare I say. It's less of a sufferation to the patient, less expense, and a better chance of survivorship. So this is what screening does. Screening looks for a disease in a normal population. And if we look, we're going to find. But when we find it, it will be at an earlier stage, which allows us to treat, to cure, and let you be in remission, and therefore increase survivorship. I plead, I implore, I beg of you, I do all of that on my knees, on my feet, everywhere. Please, please, please get screened. Look at your lifestyle. Don't be afraid of a diagnosis. Early detection is what saves lives. Thank you very much.
Wow, Dr. LeBlanc, so much rich information. I was here busy taking notes because I guess there can never be, enough education and information on this. And certainly lifestyle modification, screening, balanced diet, exercise, so many steps to attempt to mitigate this risk. I know we have quite a number of questions, so I'm going to hand you over now to Renee Barnett, who will take us through the quick Q&A session.
No problem.
Renee?
Thank you, Audra. Thank you so much, Dr. LeBlanc. Good morning, everyone. So we have a few questions, as Audra said. Our first question this morning comes from Rhonda. Good morning, Doc. My question is, how do you know when to check your doctor if you feel a pain like somewhat a lump, but feels more like a swollen tissue under your arm?
Right. So if you feel, there are two different things. So if you feel a pain under the arm and you feel like a lump under your arm, I would say go and check your doctor straight away. Yeah, because it could be, not only can it be a sign of breast cancer, but it can also be an inflammatory infectious condition where the follicles under your arm, in your armpit, in your sweat glands, becomes infected and blocked. And you don't want that to go longer than a few days, because then we have to cut and debride and clean out. It's painful, and then you can't put on your hand, and it's a whole tralala. But the minute you feel something under your arm and you're feeling pain associated, go and check your doctor.
All right, great. Thank you for that answer. On to our next question. This is from an anonymous person. If you previously removed a benign tumor and it returns after a few years, should you remove it again? Can a benign tumor hide a malignant tumor?
Right. So it depends on what the benign tumor was. So most times it depends on if you, for example, breast cysts. If we empty the cyst and we don't take out the sac, the cyst can fill again. So it really depends on what the tumor was. And if it was a fibroadenoma, you can get more fibroadenoma. So it's not that same tumor, it's the same type of tumor coming back. They don't generally hide the malignant tumors, but you can, especially for the benign tumors. Both benign and malignant tumors are also influenced by certain foods that we eat, in terms of the hormones and the antibiotics in the feed of the animal proteins that we may eat. So if you're getting a reoccurrence of fibroadenomas or cysts, then you will be diagnosed with either fibrocystic breast disease or fibroadenomas of the breast, if they're benign, and they generally don't turn malignant.
Okay, great. Thank you. Moving on to our next one. Is one supposed to squeeze the nipple to see if there's discharge, or is the discharge free flowing?
No, you're supposed to squeeze the nipple. So when you do your whole breast exam and you come in, you squeeze the nipple gently, and it's just gentle. So don't go pulverizing your nipple, just a gentle squeeze. And if you see discharge and you've never seen that discharge before, you need to look at it for a couple of days and then go and let your doctor know.
All right, great. Next one. Is it normal to have a pimple on the nipple?
Is it normal to have a pimple on the nipple? Okay, so there are glands all around your nipple. And so if there is for some reason a block of a gland, then you can get a pimple. If you're diabetic and your blood sugar is not controlled, you can get pimples all over the body, including on the nipple. But if you see that there's pimple and it's not going and it's like getting bigger, changing shape, getting more red and so forth, then you should get that checked out.
Okay, good idea too. Yes, thank you. Moving on to the next one. Is there evidence showing breast cysts turn into breast cancer at a later age?
No, no evidence as of now that breast cysts turn into breast cancer. But we do look at the cyst. So it's important to understand that when we first diagnose the breast cyst, we look at the characteristics of the cyst. So if it's a simple cyst, then those generally will not become malignant. But some cysts are complex, so they may not be benign cysts. So if you have a complex cyst, then that has to be examined, biopsied, and so forth to make sure that a complex cyst is not actually a malignant tumor that has a cystic component to it.
Okay. All right, no problem. Moving on to our next question. Why is a woman who has not had children a risk factor, or even a woman who has had her first child at an older age? Can you say some more on this?
I know it's rough, isn't it? It's due to the hormonal influences. So our hormone levels impacting on our breast tissue and our body on the whole, but especially the breast tissue. So that's why it's a risk factor. But it must be noted that it's not a very big risk factor. It's just that it was seen in a small population of breast cancer patients.
Okay, no problem. Thank you. On to our next question. Is it possible for someone to get breast cancer with no prior family history of any types of cancer?
Oh, yes, definitely. Definitely. Cancer is a lifestyle disease. So it's based on your lifestyle. So you could have absolutely no family history and can be considered very low risk. But the reality is that it depends on where you work. It depends on what contact you may have had with certain carcinogenic substances. It depends on your lifestyle. Do you smoke? Do you not smoke? Excessive alcohol intake, the type of diet that you have, and you can get cancer with no family history. Absolutely. This is why it's important, no matter what your family history is, to always do your screening tests and your self-breast examinations.
All right, thank you so much. This one is not a question, but a comment. Hi, doctor. I do have a question, but I was happy to hear that. She probably said I do not have a question, but I was happy to hear that you have a machine to accommodate persons like myself who are not well endowed or flat chested. I just turned 40 and was always worried about seeing. This information was great news for me.
Yes, I know. We definitely are happy that they made paddles for smaller breasted women, and you know it really is. It's a, I would say it's very nice. It allows for less discomfort. Let's just put it that way. Yes.
Yes, indeed. Thank you. A next question just dropped in. Is it normal to have one breast significantly larger than the other, especially in a teenager? Should that be cause for concern?
Right. So if there is one breast very with a disproportionate to the other one, I do recommend that teenager be taken to the family physician and then later be sent. She should be referred to the endocrinologist, the pediatric endocrinologist, because there may be an issue with why the other breast is not growing, or why the other one is growing at a faster rate. So that should be worked up. There are diseases, hormonal imbalances that can cause that to happen. They're not very common, therefore it has to be worked up. You have to ultrasound the breast, go through everything, check hormonal panels, and a pediatric endocrinologist is the best person, along with your family physician, to work that up.
Okay, awesome. Thank you for that. Moving along nicely. So is it possible, are there any implications to putting in breast implants after having breast cancer?
Make you look nice. No. Oh gosh. No, the breast implants have actually also been modernized, and therefore they're safer breast implants now. And I mean, the reality is that our womanhood is sometimes, we identify it with having breasts. So there's nothing wrong with doing breast implants. There is no risk of breast cancer. They actually, in some countries, after the mastectomy, they put in expanders to start to prepare the breast tissue for the implant while they're doing the treatment, and then they put in the implant after. So there's absolutely nothing wrong with that, because again, you remember, you can't let the disease define you. You have to decide how you're going to walk and journey with that disease and overcome it. And you have to decide as a woman, do you want to be flat? Do you want perky ones? What do you want? And what is making you happy and at peace? And so that's very important. So it's really a personal choice, but we do see a lot of women doing implants.
Okay, all right, thank you so much. On to our next one. This one is a popular one here in the Caribbean. Can you get breast cancer if someone strikes your breast very hard? Example, playing a contact sport, and the strike is not intentional.
No. I know. We used to say when you get hit in your breast, you're gonna get breast cancer, but there's no research yet to say that trauma will cause breast cancer. You might get a hematoma or some little, a lump and a soft tissue injury, but no breast cancer proven from a hit in the breast.
All right, thank you for that answer. All right, the next question, can lymphatic massages help remove a small lump in breast and even reduce the risk of breast cancer?
No. Okay, so your lymphatic system, which works in tandem with your circulatory system, so your arteries and veins. So your lymphatic system carries lymph, right? So that's the serum of your blood. Mm-hmm. So when cancers spread, they spread via the lymphatics and via blood, right? Or they seed off and actually just go on to another organ. But they will get to the organ via either lymphatics or blood supply. If you do a lymphatic massage, it will not necessarily get rid of the lump. What a lymphatic massage will do is that it helps to remove pooled lymph from an area. So for example, some women before breast cancer surgery, or some women just tend to have lymphatic blockage, or there's just not enough movement of the lymphatics, for example, depends on positioning of the body, obesity, and other factors. And there are actually some infectious diseases that cause blocked lymphatics, like filaria, for example. So lymphatic massages help with what we call lymphedema. And sometimes just around your period, PMS or ovulation, you feel kind of funny and distended and all these things. So a lymphatic massage helps with that, because you're helping to push the lymph away from the tissue and to feel less distended. It will not get rid of a lump though. So it will help you with distension. And when women have breast cancer surgery, we do something called where we take out nodes, especially axillary nodes. So when we take out the nodes, that hand that we took the nodes out of can swell. So we do lymphatic massages to help the lymph nodes and the lymphatic system that is left, to help drain the lymph into the collection system that is left, because we've taken out some of the axillary and accessory nodes.
All right, thank you. Thank you for that thorough answer there. On to our next question. Can you give some advice on ways to naturally normalize our hormones?
Don't be a woman. No, I'm just kidding. Let me tell you something. Our hormone system it's as I always tell you all, your body is an amazing system once in optimum balance, that it's triggered to keep everything in balance. So from a woman's point of view, dealing effectively with stress, getting effective sleep, looking at the quantity, or I should say the quality of chicken. I have to point out chicken that we put into our bodies, because if the chicken is foreign and has a lot of antibiotics and hormones in it, so you notice what I said, foreign with antibiotics and hormones, because you can get some chicken now that says no antibiotics, no hormones coming from the first world, or you can buy local chicken with no antibiotics, no hormones, or you can buy local chicken with antibiotics and hormones. So you have to look at the content. So an excessive soy intake, for example, because that impacts on our hormonal axis. So natural ways is, first of all, about you doing self-care. It's about you looking at your body and focusing on your body and your exercise patterns, what you eat, how you eat. Don't eat during a meeting. Be conscious of the food you're eating. Feel the flavors. Have those spicy mixed with sweet flavors. Those are the steps, you know, and might sound airy-fairy, but it works. What else can we do? Now, if there's a severe hormonal imbalance, and for example, your periods are spotting, if you have PCOS, if you're going into perimenopause, there are herbs that will help with regulating your hormones and therefore having normal and regular periods. But to me, the most natural way, and I could mention some of them, which includes primrose, which everybody likes to buy, black cohosh, blue cohosh, we have maca, we have ashwagandha, we have a few of them, nettle. So it depends on what is going on in Vitex, what's going on in the woman, and what exactly is being seen. So I always recommend, don't just pick one up and say, oh, this will regulate me. But natural ways, we have to first start with ourselves. We have to look at what we're eating, how we're eating, our exercise, and our stress. Because stress, if your body is in constant fight or flight, and you're not attending to the rejuvenation restoration practices of your energy and your meridian pathways, you will have an impact eventually on all of your body, and that includes your hormone levels. Did I answer?
Yeah, I did. Thank you so much. It was very detailed. I actually have a follow-on from that. Can someone use natural homeopathic treatments then to treat cancer itself?
So I'm a herbalist, as you heard in the introduction. I would say don't ever use herbs as an alternative to chemo. You can use it with chemo. So there's a practice in Chinese medicine that works with chemo and with cancer treatments. And so it's important to understand that while there are natural remedies being researched in terms of supporting women with breast cancer, one that's very popular is the soursop leaf. Nothing, if your oncology team says chemo, radiation, surgery, you do that, and there are herbs that can be used before, during, and post treatment. So it doesn't have to be either or, it should be integrative and complementary.
All right, thank you so much. On to our next question. If I was diagnosed with breast cancer, is it recommended that I consider a double mastectomy? Is it expected that the second breast will become infected?
So my honest opinion and my honest answer to that is that if you are diagnosed with breast cancer in one breast, depending on the stage of that cancer, depending on if that cancer and the type of cancer it is, that will determine if it's recommended a double mastectomy or a single mastectomy. I have seen women who chose to just do one mastectomy unilateral and then had to go back and do the second one. I do think it depends on the type of cancer. And so if a mastectomy is recommended, I would say consider doing a double mastectomy one time, because usually the mode of travel of breast cancer will be from the one breast, it goes locally, it goes to your axillary nodes, it goes to the contralateral breast or the opposite breast, and then it starts distant spread. So I would probably recommend that you really discuss with your oncology team based on the type of cancer and the staging on whether a double mastectomy is an option.
Okay, all right. Thank you so much for that. A question that just came in, is eczema of the breast associated with breast cancer?
No, if you have eczema, and you know you have eczema, then you're accustomed to eczema on the breast, then that's fine. It's when you see a strange rash that is not what you're accustomed to is when you should get it checked out. That being said, I mean, look at your eczema, because eczema is also stress related. So look at your eczema and see if there's any change of the rash, of how it's occurring or anything like that, and have it checked out, and don't be afraid to speak to your physician about it. But eczema is not a known risk factor of breast cancer.
Okay, great. That's a good one. So thank you so much for that response. All right. Rhonda is sending through a comment. Thank you so very much, Doc, for your real answers, which will resonate with me for quite some time. Very informative.
You're most welcome. That's what I'm here for. I mean, it's important to understand that we're human, we doctors, and I think the best way to communicate to all women, to all patients, is to give you it as real as possible, give you the truth. As you can see with the COVID-19 pandemic alone, it looks like if doctors may not know all, and we do not know all, and everything changes. But what is important is that year by year, day by day, with research that's being done, as soon as it's proven and we know that it's tried and tested, then we will implement it, especially when it comes to cancer.
Great. Moving on nicely. Are you seeing a growth in the number of men getting breast cancer? Is it yet at a point of concern?
No.
Okay.
We're just being inclusive. And then, with inclusivity, the more men that are exposed to external hormone levels because of maybe wanting to have a sex change operation or transgender, and the world of changing sexual orientation or your sex on the whole, when you expose to excessive hormones, we do have to consider that to be a risk factor. So while we are not seeing it as an increase as yet, it's just important to be inclusive and to let men know, that you are at risk. And if you are exposed to a lot of hormones, you're even more at risk.
Agreed. Thank you so much. Can you speak about the process? Let's say someone has suspected that they have breast cancer. Can you walk them through the process of what they should do?
Right. So I wake up in the morning and I feel in a lump a whole month now, 2 months now. I'm getting pain in my breast. It's not cyclical. It's not going with my period changing. So I'm concerned. I've done my breast exams. I'm concerned. I go to my doctor. Your doctor then says, well, Asante, you're over 40. I am. Time for, when was your last mammogram? Oh, geez, doc, I didn't take it. Damn thing's painful. I don't have time for that. COVID come. I don't want to go nowhere. Okay, you need to go for your mammogram. I go for my mammogram. Oops, Asante, there's a suspicious lesion, but also you have dense breast tissue. We think that you should do an ultrasound. Ultrasound, oops, suspicious lesion. Doesn't look like it's benign. We need to do a ultrasound guided biopsy. Great. Go back in, Cancer Society again. All this can be done at the Cancer Society. You do your ultrasound guided biopsy. We send it off to the lab. The lab says confirmatory. Patient has breast cancer. We have to do hormonal staining. Comes back to the Cancer Society with all those results. We give you the results in a calm, cool manner, ensure you have family around, somebody you can have support with, and then refer either to public or private sector for treatment. In the public sector or the private sector, you meet with an oncologist, a medical oncologist who will go through everything, send you for blood work you up, go through the entire process. Based on those results, send you for a CT scan to see if it's spread anywhere. We stage it and everything. The cancer is staged. Once everything is there, the oncologist will decide what treatment regime, offer it to you. You then have a choice. You choose. They will tell you all the side effects of everything. You choose your treatment regime and then you start it. That happens in both public and private. Yeah.
All right, thank you. You mentioned the significance of the dense breast tissue just now. So why is that significant?
Because they hide the little lumps. So dense breast tissue is considered a risk factor, and a lot of us in the Caribbean have dense breast tissue. So that's why it's important for the dense breast tissue women to, most times we do the mammogram and the ultrasound so as to be much more complete in their screening. Yeah. Because they have little things hiding in all those densities.
Okay, well, thank you so much for that. You also mentioned, support of family and friends. So can you speak about the type of support that family and friends should be aware of to help the breast cancer patient?
First of all, they're not dollies that are going to break. So don't be like, oh my God, she's gonna, no, just go normal, because most of them just want to feel normal. Okay, most women want to be normal. It's important to understand that you may not be able to handle it yourself, especially if it's a loved one that is being diagnosed and you're fearful of losing that person. We at the Cancer Society offer counseling to both the patient and their family. It's important to understand that that person has the right to choose their way and how they want to live. It's important to support emotionally and be there for them. Be ready for when they shout at you. They don't want to talk. They want to talk. It depends on the personality of the patient before the diagnosis. It depends on the outlook of the patient before the diagnosis. But you should know your friend, your relative, so you know what to do. So for example, when my grandmother was diagnosed, we knew the type of woman she was, so you knew how to treat. So you didn't treat her like, oh my God, don't tell her, don't tell. No, she wants to know, this is what could happen. This is the worst case scenario. How do we treat with this? Make a joke. Life still goes on. The cancer cannot become the only thing you know to talk about. Life still goes on. And that is important to let them be. Let them still be alive. They're not dead. They're alive. So you have to listen to them and have effective communication.
All right. Awesome. Thank you. This question just came in. Should removal of lymph nodes now expose your body more easily to infection of cancer?
No. The reason they remove the lymph nodes is to help with staging. Mm-hmm. Because the cancer may have spread already to the lymph nodes. So they have to remove the lymph nodes because of staging, right? It does not increase your risk for infection because your body is filled with lymph nodes and a lymphatic system. We're not suppressing your immune system. Some of the chemo drugs, however, can suppress your immune system, right? And that is why we focus so much on the cancer patients as a high-risk group for COVID-19, because their immune system is suppressed if they're undergoing chemo and radiation. So taking the small amount of lymph nodes is the stage, but also it is if in case we did feel a lump under the arm, we have to remove those lymph nodes and test them.
Okay, all right. Thank you so much for that one. Going back to discovering your lump. So you mentioned the lump. We spoke earlier about rash and secretions from the nipple and so on. But apart from those, what are the other ways that breast cancer can present?
Well, the nipple discharge. So if you get nipple discharge and no lump, then they will take the nipple discharge and send it for testing, right? If you get the rash on the breast, they will test that rash and the skin. But remember, when you see the rash, they will still do the mammogram because it could still be in the lining and not be seen. So sometimes we'll even do things like ductograms and work you up based on the discharge to then reach the level of the mammogram. So it really depends on what symptom and sign is being presented. I gave you the lump because that is a common one. But if you feel something strange in the breast and you're not feeling a lump, but you're seeing discharge or a rash, your doctor has to work it up. And they will work you up, including the mammogram, but they also have to do certain other tests of the skin, blood work, and so forth to see what is going on.
Okay, all right, thank you so much. And our last question before we hand back over to Audra, just to wrap up. What are the recent advances in cancer treatment?
Besides immunotherapy, we have some newer chemo drugs, but there's nothing out of the world, like nothing new that is like blow mind. I mean, they've gotten new drugs that may have less side effects. They have immunotherapy for metastatic breast cancer, but I think I really want people to understand, don't keep thinking about what is new in treatment. If we can think about screening and prevention and proactivity. And I know Trinidad is considered the West Indies, the Caribbean region, and you know, to think that we have lost some oncology drugs. We've had our little debacles over the COVID-19 pandemic. But it's important to understand that Trinidad is not alone in that fight. It's happened worldwide, and cancer drugs are very expensive. So this is why it's so important to be detected early, because the cost of a cancer patient, the cost of treatment, depending on the stage, is a huge difference. So while there are new drugs, Trinidad and Tobago, as soon as the newer drugs are approved, once the company brings it to formulary here to be imported, it's accepted once it has all the paperwork. You understand? But the oncologists also fight for newer treatments. You understand? So to me, the most important thing is understanding, yes, there are newer drugs. Yes, there's immunotherapy. You can do so much. You can have treatment outside if you have good insurance as well. But it's important to first get that diagnosis. And that can only happen if you do screening for early detection, because that will determine your survivorship. And I want that to ring home. You know, so I know you all have heard of the PET scan. Don't go and do a PET scan as a screening test. That makes no sense. Follow the procedure, follow the steps, and then if we need to do the PET, we will do the PET. But don't just jump because you think, I want something that will show my whole body and show me a. No, that's not how you work. You don't work from front to back. Small steps. You have to do the small steps. Let us do it in the algorithm. Let us follow it and understand your part. Play your role. Take an active part in your health. You know, educate, lifestyle modification for the whole family, because it's not just breast cancer, it's all cancers. Exercise, stress coping, and get screened. That's so important.
All right, wonderful. Thank you so much, Dr. LeBlanc. We hand back over now to you, Audra.
Great, thank you so much, Renee. You know, what a wonderful discussion and lots of amazing questions, giving us a lot to think about, you know. So on behalf of all of us, you know, from Massey, I wish to thank you, Asante, for such an informative session, inclusive of sharing with us some of the new developments in this fight. And just as you said at the end, you know, just want to remind, you know, all our attendees, remember lifestyle modification, screening, a balanced diet, exercise, you know, all these steps in mitigating this risk. I'd also like to take this moment to congratulate you, Dr. LeBlanc, your organization, the Trinidad and Tobago Cancer Society, on celebrating 50 years. Thank you to you and your team for all the work you do and the lives you touch.
Yes, I'm really grateful, and I like these opportunities. I want you all to know that this has been one of the worst 2 weeks of my professional career, having to break news to patients that they did have cancer, but at the same time, it was such an empowering moment because I got to say, your cancer is at a stage 1, your cancer is in situ, and you're going to hear the same story. I really didn't want to do the screening, you know, but my sister had it, and so I think I might do it. Don't wait for that. Buddy up. That's our theme this year. You know, no man is an island. More so through this pandemic, we have learned how precious life is. And yes, please, just buddy up. Go do your mammogram together, your pap smear together, walk together, laugh together. Do not take those small changes for granted. They have a huge impact on your lifestyle. And I'm forever here to explain, to talk, to debunk whatever you need. Call on us. We will help you however we can. We're all in this together. And I thank Massey because you all did a whole month of sponsorship for my radio program. And I talk about breast cancer. So you all get information out the wazoo. So I must say, you know, follow us. We have tips on our sites. We have tips on the Cancer Society and Victoria Clinic. You know, there's information out there. And I want you to get it from the right sources. I don't want you to get Googleitis, which is what everybody had during the pandemic. And no matter what, we're here to support. And thanks so much, Audra.
Thank you so much. You know, really appreciate the work you're doing, you know. So I would like to also thank my MLI team and Jamon Alain, our tech support, without whom none of this would be possible. And to your attendees, thank you for your continued attendance and support our webinars. We look forward to seeing you at our upcoming sessions. So continue to look out and sign up for our paid programs, our webinars, everything aimed at getting your future ready. As Dr. LeBlanc said, we're really in this together. So remember, keep safe and keep leveling up. Bye for now.